sponsored by Cancer Treatment Centers of America and Iman Cosmetics, and in partnership with the Breast Health Collaborative of Texas. I'm Kelly P. Hodges, the National Program Director for Sisters Network and facilitator for today's webinar. As most of you know, Sisters Network is a leading voice in the only national African American breast cancer survivorship organization founded by Karen E. Jackson in 1994. Sisters Network is governed by an elected board of directors and assisted by an appointed medical advisory board. Our purpose is to save lives and provide a broader scope of knowledge that addresses the breast cancer survivorship crisis affecting African American women around the country. Sisters Network is very excited about Webinar Wednesday. Thank you to those who have participated in previous webinars. If you've missed them, the webinars are on the homepage of our national website. They're also available on our YouTube channel, which is Sisters Network Inc., Sisters Network INC. But a couple of quick notes before I introduce today's presenters. The Q&A session will take place at the end of the presentation. Please note your questions and hold until the end, and every effort will be made to address all questions. Additional questions can be emailed to jessica.weeks@ctca-hope.com, and we'll have that displayed on the screen at the end of the presentation. Sisters Network aims to provide useful and informative information to survivors, caregivers, health professionals, or those who want to know more about health care, breast cancer, and survivorship. So without further delay, I would like to introduce our speaker for today, Dr. Laurence Altshuler, board certified internist, who we call Dr. A. Doc, hold on just a moment.
I hope you all can hear me. I haven't been able to hear very well. If you can't hear me, let me know. But we'll go ahead and start talking about
Actually,
Oncofertility.
Dr. A, I was gonna, I was gonna finish introducing you if you
Oh,
don't
okay. I'm
mind.
sorry.
But if you're
We
okay,
can barely
yeah,
hear you, so
no, no,
that's
no.
why we couldn't pick that up.
Okay, okay, hold on. How is my audio on this end? Is if everyone can hear me okay, I can continue. If not, we can go ahead with the doctor. Am I coming in clearly? If I'm coming in clearly, just raise your hand. It's very quiet. I'm not sure. Okay, Dr. A, you can go ahead and I will add to you at the end. Okay, go ahead. I will go ahead and, Dr. A, I will turn the presentation over to you. Thank you.
Okay. Let's talk about Oncofertility then. Um, okay. Obviously, and unfortunately, we're seeing a lot of younger patients now with cancer. And that's very important because many of these patients still want to have children, but they are going to undergo surgery and chemotherapy and radiation, which is really going to affect their reproduction organs. And so it's very, very important before starting treatment that any patient who wants to have children after treatment uh, talk to their doctor about doing what's called oncofertility. And oncofertility, onco is the cancer part of it, and of course the fertility is the fertility part. So we're going to talk about what you need to know about preserving your fertility if you want children and you have cancer. So first, let's talk about how does cancer treatment affect fertility. Uh, and each year, about 100,000 people under the age of 45 are diagnosed with cancer in the United States. Now, this is important because of that age of 45. Certainly, women up to 45 can still have children. Men who are older than 45 can still have children. But really, 45 is the age that you're thinking about that. So if you're younger than 45, you can still have children. And so there's a lot of people being diagnosed with cancer under that age. And of course, many of these individuals will receive treatments that will affect their fertility, either the ovaries or the testicles, the sperm production. And according to the National Cancer Institute, the estimated number of reproductive age cancer survivors is approaching 500,000. As you know, we are really winning the war against cancer, although the incidence of cancer actually is increasing a little bit because of our older generation. We are actually patients are surviving longer that have cancer. In fact, the mortality rate for cancer has gone down 20% in the last decade. So again, we're seeing a lot of younger patients with cancer, but they're going to survive longer, and we're going to have lots more survivors, and they may want children after treatment. Now, of course, being told you have cancer and that you may lose your fertility from treatment, that certainly can be devastating if you've been planning on a family. Of course, there's a lot of patients that, when you're diagnosed as having cancer, you're going to be pretty freaked out, and you're going to want to treat that cancer as soon as possible and get rid of it. And you may not even think about fertility or think about having children, but it's something that we really need to think about if you're young. And fortunately, there are a variety of options to preserve the fertility for anyone affected by cancer that want to have children. Now, the likelihood of reproductive damage from cancer treatment, of course, depends on many, many factors. First is your age and the fertility status at diagnosis, because, of course, some people may not be very fertile, and you may be, of course, older and not be able to conceive. Of course, gender is a factor, because males and females have, of course, different organ systems, and so cancer treatment and cancer can affect them differently. The cancer type is very important. There are certain cancers that can affect fertility, and then there are treatments of the cancer. Certain treatments may not affect fertility, so depending on the cancer that you have, treatments may or may not affect fertility. However, I would say that most cancer types may need treatment, either radiation or chemotherapy, that will in fact affect your fertility. So you should always check it out, no matter what cancer type you have. The stage of the cancer is also important, because if your cancer is spread, then you may not be able to undergo fertility treatments. And then, of course, the treatment regime is really the most important thing, because it depends on what kind of treatment you get. Because again, there are certain chemotherapies that don't affect fertility, but a lot that do. Radiation, depending on where the radiation is on the body, can affect it or not affect it. And then the length of time and how much you get can also affect it. Now, for men, cancer treatment can affect the normal quantity, the speed, and the shape of the sperm. For women, of course, it's different. You have eggs in your ovaries, and of course, it can not only affect the eggs, but affect the hormonal balance of your body, all the hormones that are required for you to become pregnant and keep that pregnancy, and then deliver a healthy child. It can also injure the reproductive organs themselves. Now, there are a lot of causes of infertility. Of course, cancer itself can actually cause infertility. Cancer like testicular cancer, of course, affects the sperm. Certain types of lymphoma, like Hodgkin's lymphoma, can actually directly affect the ovaries as well. And of course, surgery is a factor too, because if areas of the reproductive system have to be removed or have to be addressed, it can affect them. A woman may have part of her ovaries or uterus or cervix removed. The man may have his prostate removed or his testicles. And of course, that directly affects whether they can become fertile. And sometimes surgery can cause scarring in the areas that you need to have to become fertile. The fallopian tubes, of course, connect the uterus to the ovaries, and a lot of abdominal surgery can cause scarring in the fallopian tubes. And when they scar down, the sperm and the eggs cannot pass through the fallopian tubes, which is necessary to become fertile. Some other types of surgery, especially for men, removal of the lymph nodes in the pelvis, but also for women, can damage the nerves, and that also can cause problems with men ejaculating. Now, of course, chemotherapy is probably the main concern that we have. Depending on the type and dosage of the drugs that are used, Chemotherapy can damage or destroy either the eggs of a woman or the man's sperm. It can also reduce sperm production or limit sperm mobility. It can also affect a woman's menstrual cycle. There's many women who, once they get chemotherapy, they're actually put into menopause. And of course, when you're in menopause, you're not making any eggs, so you can't get pregnant. Now, radiation therapy is probably the second factor that is of most importance. And again, depending on the dosage and location, radiation therapy, especially to the lower pelvic region, can damage or destroy a woman's eggs and cause early menopause, or damage the uterus and make it difficult to maintain a pregnancy. On the other hand, for men, radiation to or near the testicles can certainly harm sperm production. Radiation to the brain, especially like the pituitary gland, can affect fertility in women and men because it interferes with the normal hormone production. The pituitary gland makes hormones that actually stimulate the production of the hormones that men and women normally produce in their ovaries or their testicles. And so, if the pituitary is not working, then it's not going to produce those hormones, and you can't get pregnant or have your spouse or significant other get pregnant. So it can affect all sorts of things besides the ovaries. Also, some radiation to the abdomen, even though it's not in the pelvis where your ovaries or testicles are, you can get what's called scatter from radiation, depending on the dosage. And that scatter can actually bounce around your abdomen and still bounce down and affect your ovaries and testicles. So it's very important to know what kind of radiation and the dosage you're getting and exactly where it's going. Now, there are other treatments that can affect fertility. A stem cell transplant for people with leukemia or lymphoma can affect fertility because the procedures done involve high doses of chemotherapy and often radiation therapy. And as we said, both of those can affect fertility. And then a lot of people may get hormone therapies, for example, prostate cancer, breast cancer, and that can affect fertility as well. Fortunately, that's usually temporary, however. Okay, so what are some of your options for having children after cancer? Because certainly that is possible. And there's a large range of fertility preserving options. Now, some of these options can be time consuming and they can be expensive, and we'll talk about that later. And they can pose other challenges for people with cancer because a lot of times, if a woman comes in, they're young and they need fertility preservation, if they have a cancer that is very aggressive, the medical oncologist may say, we cannot wait for you to do fertility preservation. We need to treat you now. And so that can affect whether you can get it or not. So it's important to discuss all of these with your doctor right at the onset of diagnosis and before you get the treatment. However, there are lots of different options, both with you becoming fertile or fertilizing or other options. Now, if you want to have your own children, if you're a woman, they can actually save your eggs. And those can be used anytime 10, 20, 30 years from now if necessary. They can also freeze embryos. Now, embryos are the fertilized egg. So basically, if you are married and you actually want to start a baby, your egg and your husband's sperm, they can put that together, make an actual fertilized embryo, and freeze that as well. They can also take portions of the ovary and freeze those and preserve those as well. Now, if those don't work and you can't have children of your own, your fertility is affected, there's lots of other things that you can do. I mean, obviously, other people can donate eggs or embryos, and you can actually have those implanted in you or other people. If it's in other people, those are called surrogates, in which you could take your eggs and your husband's sperm and actually put it in a surrogate, and they can carry your child for you. There's also what's called GnRH analog treatment. That's called gonadotropin releasing hormone. That's, again, a pituitary hormone. it produces stimulation of luteinizing hormone, or LH, which is important for getting pregnant and keeping the pregnancy. Now, there's other things you can do with the cancer treatments if you want to have a child. There are certain surgeries you can do that can spare your fertility. A lot of times, if you know that you're going to get radiation, you can actually take the ovaries and you can pin them up into a different area away from where the radiation is going to be. There's also some drugs that can protect you from chemotherapy, so the chemotherapy cannot harm the ovaries or the sperm. There's also techniques to protect the reproductive organs during radiation, like I just told you about putting the ovaries in a different area away from where radiation can be. And of course, there's sperm banks. A lot of our patients who are male will save their sperm. That's very easy to do. It's very quick. And those sperm can be frozen and preserved for years and years and years. We're talking about the surrogates. And of course, there's always adoption. Keep in mind, of course, that all of these are options, but they may not be specific options for you. But at least if you talk with your doctor, there are enough options that you can preserve your fertility and have children in your future. So let's talk about fertility questions that you should ask your doctor, because these are very important. You can take these to your doctor and make sure that they answer your questions. And by the way, if your doctor will not answer these questions, you might want to get a second opinion. But these are the questions that we would like you to ask, and what we actually talk to our patients about. How will my cancer treatments affect your fertility? What are my fertility preservation options? Will any of these options interfere with the treatment, especially delaying treatment? Will any of these options increase the risk of cancer recurrence? What is my chance of infertility? And is it likely to be short-term or permanent? Because again, some of these may be temporary. Chemotherapy effects may not be long-lasting, and after a certain amount of time, and we'll get into this, you can again be fertile. Then you can ask, are there other treatments that won't affect my fertility but are equally effective? Is it safe for me to get pregnant during treatment? And that's very, very important as well, because a lot of chemotherapies and radiation can affect an unborn child. How long should I wait after treatment ends to start a pregnancy? And that's important as well. And sometimes it's 6 months, sometimes it's 2 years. You can ask, if I become infertile after treatment, what are my options for having children? And then finally, where can I find support for coping with fertility issues? Okay, how about your fertility concerns? And let me give you some tips about that during your cancer care. First of all, please know that you're not alone. Just being told that you have cancer and the treatment you need may affect your ability to have a child, again, can be very, very devastating to you. It can also isolate you. So it's important for you to understand that you're not alone. There's people around that can help you, and they can support you and guide you very, very well. Then you probably need to ask yourself questions. If you may become infertile, you need to ask yourself to better understand your feelings about parenthood, because maybe you haven't thought about having kids, and now is the time that is going to kind of force you to think about them. Have you wanted to have children? Are you unsure you will want a child, but at least want the option? Because even if you do fertility preservation, you may decide later you don't want a child. And how would you feel about having a child that isn't related to you, such as adoption? And are you open to using donor sperm or donor embryos, or using a surrogate? So it's very important to be upfront with your doctor. I'm going to tell you that many doctors may be so focused on treating your cancer that they're not going to talk to you about fertility. So you need to be empowered and bring it up. So talk with your doctor about your fertility concerns before the treatment begins. An open discussion will really help you better anticipate what you need and what to expect. Again, ask what your treatment is likely to do to affect your fertility. Find out about all the options to protect your fertility, both before and during and after treatment. Ask about whether anything can be done to lessen the effects of treatment as well. And then, of course, you need to talk to your partner. Now, certainly, if you're single, you're going to have to make those decisions for yourself. And many of our single patients do decide to preserve their eggs. But if you're married or have a significant other, uh, you and your partner need to talk about it. You may not be ready for a family yet. Regardless of which stage of family planning you're in, it's important to communicate this and find out from your partner what they think as well. Let your partner know how you feel and find out how your partner feels. Okay, and finally, again, you need to explore all your options, and that's very, very important because there are many options, as I already pointed out. Learn about all the options before your treatment. And then when you get with someone who knows about oncofertility, they will tell you, of course, the risk and the successes of each type of option. Learning about those options then will help you feel better about your choices. Right now, the most established options are sperm banking for men and freezing your embryo or egg if you're a woman. You really need to protect what's important to you. You know, if you've always wanted to have children, don't let others talk you out of it or minimize this desire. This is your life. These are your children that you're contemplating, so it's really your decision. Sometimes cancer-related infertility is not discussed as it should be. The disease, again, will take priority. You know, you have cancer, you want to get rid of it. And that's understandable and necessary. But you still have the right to protect your ability to have children in the future. And it can be done very, very quickly. So that's a consideration. Okay, then, of course, once you make that decision, consider the challenges. When you're researching your options, keep in mind that they can be expensive and they may not be covered by your health insurance. Now, we will talk about this later because there are a lot of people out there that can help you, a lot of organizations. Now, some options are time consuming. It can take some women 3 or 4 weeks before you can preserve your ovaries, and so you're delaying your treatment. So you may have to postpone treatment, and you need to know if that's going to hurt the cancer treatment. So don't be afraid to get a second opinion before making those important decisions. And then, of course, seek out the resources. You need to ask your doctor about fertility resources and referrals. There's quite a few doctors out there that specialize in fertility. There are reproductive endocrinologists, there's sperm banks. There's also actually fertility centers out there. Then you need to also find out about the sources for financial assistance as well as adoption agencies if you decide that. It really helps to talk to a fertility counselor or join a support group. Now, there are some very interesting organizations that really help with finances and help with options. Fertile Hope is a Live Strong initiative that provides helpful information and actually can provide some financial assistance. Walgreens offers a program called Heartbeat, and they offer financial assistance to many cancer patients as well. Also, I need to remind you, don't give up. If you've dreamed of having a child and you've already finished treatment without undergoing fertility preservation procedures, it doesn't mean that you still can't have them. If you can't conceive naturally, then you may decide to pursue a surrogate or adoption. Many people choose adoption regardless of whether or not they have biological children. Understand that some states, however, do not allow surrogacy, so you have to check into that. And then, of course, learn about the risks of being pregnant. Talk to your doctor about when it is a safe time to begin a pregnancy. Your doctor may advise you to avoid pregnancy during cancer treatment, again, because some treatments may cause birth defects or harm to the developing fetus. Also, you may need to wait for a period of time after treatment to avoid miscarrying or having a premature birth. Okay, so let's talk about starting a family after cancer treatment. Again, once cancer treatment is complete, you've beat the cancer, you fought it, you're now in remission, you're a survivor, but even then, that can overshadow your fertility concerns. You may not even think about it. While many cancer survivors are able to conceive naturally after treatment, many actually require assisted reproductive technology. Again, the cancer and the treatment may have hurt your ability to become fertile, but again, that can be addressed. For example, many men who lose sperm function as a result of treatment can eventually regain their fertility. However, it can be more difficult for women to regain that. Now, women are often advised to wait about 6 months or longer after treatment ends before trying to conceive because their eggs can become damaged from exposure to radiation and or chemotherapy. Fortunately, most women will produce new eggs, and those new eggs can be very good. So if you wait long enough, the effects of the treatment can go away, and your eggs will be able to become fertile and have a normal child. Now, some doctors recommend waiting even 2 years before trying to get pregnant to make sure the cancer doesn't recur within that time. Because if you got pregnant and it recurs, then obviously there's a real decision to be made about carrying the child or treating cancer or delaying cancer treatment. Now, also, women need to be closely monitored if that happens during pregnancy because sometimes the cancers seem to recur during pregnancy because of the hormonal changes. Now, men should wait about 18 to 24 months if they receive chemotherapy that can harm the sperm. But after 18 to 24 months, again, new sperm is produced and you'll be able they will be viable and the child can be normal at that point. Okay, so let's kind of summarize what we said here. Number one, you need to discuss the risks, the effects, and the options for fertility with your doctor as early as possible. As soon as you're diagnosed, you need to find out what your options are. Then research your options. Understand the financial effects, who's going to pay for this, the physical effects on your body, and also the emotional changes associated with each. Seek out another opinion if necessary. Again, if your doctor doesn't talk to you about it or doesn't have a connection with a fertility center or fertility doctor, or maybe that institution doesn't do oncofertility, go to one that does, or go to a doctor who will talk to you about it and understands your needs. Then communicate with your partner to determine the best options for both of you. Utilize the local resources for support. Again, there's outside sources that can help direct you to the right people. And don't ever give up. Again, if you plan ahead, you can still have children. So how about any questions out there?
Okay. Okay. Thank you so much, Dr. A. That was a great presentation. Can everyone hear me? I feel like I can't hear anyone. If you can hear me, raise your hand. Trying to. Okay. Can you hear me? I need some. Okay. Yeah. Someone raised their hand, so we're good. Okay. We will start the question and answer section now. The first question is: are the medications dangerous to freezing the embryos? And Dr. A, you can respond. The questions are on the right side. I can read the questions, and then if you could respond, that would be great.
Okay, that's a really good question because especially for women, what you want to do if you want to preserve your eggs, we like to is called hyperstimulation of your ovaries. If we just look at for eggs, during your reproductive cycle, you may only have one or two that are able to be preserved. But if you take certain medications, it can hyperstimulate your ovaries and produce lots of eggs, maybe 12 or 14 eggs, which of course gives you a much better opportunity to have children later in life, and you have a lot more eggs that can be fertilized. Now, those drugs can be pretty, are used, they're hormonal drugs to hyperstimulate you. You can actually have some side effects from the hyperstimulation. It's called hyperstimulation syndrome, but that is only temporary. Now, I will tell you, however, the medications are actually indicated to help you freeze the embryos. They do not hurt the embryo. They do not hurt the eggs. They're actually designed to protect the eggs and to protect the embryos. So, although they're pretty powerful drugs, they're not going to interfere with the preservation, and they won't interfere with any future treatment for the cancer as well.
Okay. Okay. That was a Miss Eve. I hope he answered your question as it relates to the embryos. Are there any other questions? Okay. If not, if you have additional questions as it states on the screen, you can actually email those to jessica.weeks@ctcahope.com. And again, Dr. A, thank you so much for taking the time to present today. We are going to make sure that we promote this. As you know, the webinar is recorded. We will be promoting the webinar via our website and also on our YouTube and social media channels because we know that this is a very interesting topic and that we have a lot of ladies that did express an interest in this as well. So to
There's
all of you,
one other thing that I might
uh huh,
add before we leave,
yes, sir.
is that the fertility center that people should go to is very important because there's a
Mhm.
lot of people, doctors out there that do fertility, but some of them are not as certified as other ones. If you can, find a fertility clinic that has doctors who have fellowships in fertility. Those are probably the best ones you can. Now, that doesn't mean that if they don't have a fellowship that they aren't good, but if you can choose the best ones, because everyone has they may have different techniques, and some people, some centers may not have the high tech or the high quality preservation techniques that other ones do. So again, shop around if you can, look at all your options, get second opinions, and try to get the best that you can.
Okay, very good advice, and that's with anything related to your healthcare. And Sisters Network, we're advocates for that, making sure that you can definitely, to use your term, definitely want to shop around as it relates to your healthcare, and it's okay to get a second opinion as it relates to your healthcare. Well, thank you again, Dr. A, on behalf of our board of directors, our thousands of volunteers, and our staff here at the national headquarters. Thank you for taking time out of your busy schedule to join us today. And for those of you who were able to join us today, remember if you are in the Houston area, join us on Saturday, April the 5th for our national walk. You can also walk virtually at the National African American Breast Cancer 5K Walk Run. Stop the Silence. Registration is now open. Actually, late registration has started, so you can register online for that. And also, Sisters Network, we're celebrating 20 years of survivorship this year. So please join us in Houston for our national conference and Pink Angel Awards Luncheon and Style Show, October 9th through the 14th. Registration will open later this month. And on behalf of Sisters Network, thank you for joining us for Webinar Wednesday. Until next month, enjoy the balance of your life. Thank you so much.